how do we as in my research team, how do we define relaxing music? Because we want patients to be distracted as well as experience a generalized relaxation response. So we use music that's approximately 60 to 80 beats per minute, predictable dynamics, fluid melodic movement, and very simple compositions. So how we thought about patient-directed music intervention, we modeled it after patient-controlled analgesia concepts, where we know that patients have better pain control and are very satisfied with their ability to self-administer pain medication. So I thought, well, could we have something similar for patients to self-manage their incredible anxiety that they experience while they are on the ventilator in the intensive care unit? Annie would do her assessment, and then she would tailor a collection of MP3s, CDs for the patient to be kept at the bedside. And we always use headphones in the intensive care unit for really two purposes: to allow the patient just to take in the music and to reduce some of the noise in the intensive care unit, and also to not disturb other patients or family members in the intensive care unit. So it's really two purposes. So in total, we enrolled 373 patients over approximately 4 years. And I had quite an excellent team of research nurses, and I will tell you, they screened thousands of patients to get to these 373 patients that were enrolled for at least 48 hours. The patients that were randomized to the patient-directed music intervention group listened to their music for about 80 minutes a day. Our goal was to have them listen at least for 30 minutes twice a day. So this actually exceeded our goal. And we were struck by the immense variety of music that patients preferred over the course of the time they were in the study. And my colleague Annie Heiderscheit and I, we have a paper under review that reports on all the wide variety of music that these patients requested over the time they were in the study. And over time, patients who listened to music, the patient-directed music, received less intense doses of sedative medication over the study period. And we were very happy with this finding. We really are the first group that has ever shown that you can reduce anxiety in these patients and still give them less medication. So this is really a very different way of thinking about managing this intense symptom of anxiety in this critically ill patient population. But we had comments from family members. They were proud of their loved one for participating in the study, and they were immensely thankful, because this is just not a common integrative therapy that's used in the intensive care unit, and I think it really has great potential. There were some patients that conveyed to her with note writing, that they had sort of an epiphany about, they had some strained relationships with family members. So, some of that does become uncovered when you have these really deep connections to music. And, that's something that you have to work into your consent form. And that's why the music therapy discipline is so important to be an integral member of the research team. And I always try to, ICU nurses have really good intentions, but you can't just be slapping headphones on patients. And I think so many times that non-music professionals or persons that attend conferences like this, they think music is just this benign, really nice thing to listen to, and we all know that it's a very powerful stimulus.